Right now, it doesn't have a very catchy name. We're working on that, but it will, in the phase 3 portion, have a more catchy name. But for now, we just think of it as the ISA-POM study.
Okay. Can you tell us all about that?
Happy to tell you about the isatuximab pomalidomide study. In brief, we are presenting today the final results of this phase 1b study, which was designed to combine isatuximab, which is a novel anti-CD38 molecule, along with pomalidomide in relapsed refractory multiple myeloma. The objective, of course, was to dose find the best combination, the best dose for this combination, and to prepare us for the phase 3 trial, which will ultimately yield to registration for this agent. A few of the key points that we learned from this study were as follows. Isatuximab is an anti-CD38 molecule that has been studied in many contexts before, has a very advantageous feature that it has a short infusion compared to other CD38 molecules, where the first infusion on average is less than 4 hours and the subsequent ones are approximately 2 hours. And when combined with pomalidomide and other IMiDs, has shown very significant clinical activity. So the rationale of combining this agent that works in an immunomodulatory way as well as the historical antibody means has been very effective, and we wanted to see its benefit with pomalidomide. So we initially started at varying doses, ultimately concluded on the dose of 10 milligrams per kilogram, which is given weekly for the first cycle and then every other week indefinitely until relapse, along with pomalidomide 4 milligrams. Generally speaking, this was a very well-tolerated regimen. There are about a third of patients that experience an infusional reaction, but only one patient in the whole trial had to discontinue the drug because of the infusional reaction. We report over 45 patients now who have been treated with this combination, and the most emergent adverse event was that of neutropenia, which is quite consistent with what we see with pomalidomide. As it pertains to efficacy, this combination demonstrated a 65% response rate, which is quite remarkable in this very heavily pretreated population. Patients had had a median of 3 prior lines of therapy, and 26% of those achieved a very good partial remission or greater. And finally, the progression-free survival for this group was 17.6 months. So to take a very heavily pretreated group of patients who were eligible for pomalidomide, now combining it with isatuximab, yielded a 65% response rate and a 1.5 years of progression-free survival with quite manageable toxicities. So we feel now we have the right dose to go ahead in the phase 3 study, which is actually already accruing patients, and we anticipate presenting that in the near future.